So, are you preparing for NCLEX and finding the endocrine system confusing? Don't worry. In this video, we will solve very important topic NCLEX based practice questions so that can definitely appear in your exam. So, welcome back to ManpreetRN Talks. So, pause the video, read each question carefully, and choose your answer, and then we will discuss the correct rationale together. So the nurse is assessing a client with a brain tumor who has developed diabetic insipidus. Which of the following findings would be the nurse expect? Select all that apply. Dark amber urine with sediment, high serum osmolality, low urine specific gravity, recent weight gain, and reports of excessive thirst. So what would be the correct answer for this? Pause the video, think in your mind, then let's we will discuss it together. So when you have a SATA question in your exam, so keep in mind always select that option in which you are 100% correct because there is negative marking. So I will select option 3 and option 5. So low urine specific gravity and reports of excessive thirst. So diabetic insipidus patient they have. So I will submit it. And there is option 2 is also correct, high serum osmolality. So tumor of the central nerve system. So let's discuss tumor of the central nerve system can disrupt normal physiological process throughout the body and it cause multiple system dysfunction. So one complication that is associated with the brain tumor is diabetic insipidus. So in the DI, there is an interference in the synthesis, release and transport of antidiuretic hormone that is ADH. So the decreased presence of circulating ADH signals the body to diuresis. So it can lead to further high serum osmolality that is more than 295 and hypernatremia sodium more than 145 milliequivalent per liter. Low urine specific gravity because urine become very diluted and the dehydration because patient have excessive polyuria due to increased urine output and polydipsia that is increased thirst. So option 5. So correct option are option 2, option 3, and option 5. So option 1, dark amber urine that is associated with the SIADH. That is the syndrome of inappropriate antidiuretic hormone. So what happened in this? So in SIADH, the presence of ADH is increased and the body is signaled to retain fluid. So urine output is decreased, serum osmolality is low. And option 4, there is weight loss, not weight gain in expected in DI. So increased diuresis that can lead to large fluid volume loss and that can lead to decrease in the weight. So as an educational objective, so diabetic insipidus is a complication that is associated with the brain tumor in which ADH hormone is sufficiently produced or maybe suppressed. That can result in polydipsia and polyuria. So urine is copious, that is increased amount and with diluted with a low specific gravity. Fluid volume deficit can lead to dehydration, hypernatremia and high serum osmolality and weight loss. So next question. So the nurse is assessing a client with suspected SIADH, syndrome of inappropriate antidiuretic hormone. Which of the following finding would support a diagnosis of SIDH. So now select all that apply. So just opposite DI. So there is increased urine output? No. So there is decreased urine output. And what will be the correct answer for this? Just pause the video, think in your mind, and then we will select. For my purpose, and the options are increased urine output, elevated serum osmolality, decreased serum osmolality, elevated urine specific gravity, and decreased serum sodium level. So, what will be the correct answer for this? So, in the DI, as we have discussed last, so it is opposite for SIDH. Just think and we will solve this. So, there is decreased serum osmolality, elevated urine specific gravity and decreased serum sodium level. So I will submit it and we will see. So option 3, 4, and 5 is the correct answer. So pathophysiology behind SIADS, there is excessive ADH hormone secretions that can lead to renal reabsorption of water. So that can lead to decreased urine output. So there is decreased urine output and it can lead to increased urine specific gravity. So always remember when there is concentrated urine, so urine specific gravity is increased. When there is diluted urine, so urine specific is decreased. So other that can lead to water retention. So water retention can lead to weight gain. And if there is in SIDS, there is too much water in the body. So sodium that is diluted in the water. So it can lead to dilution hyponatremia. So low serum sodium level. So patient will have altered mental status changes like confusion. Patient may have lethargy and low sodium level can lead to seizure. So that is the correct answer for 3, 4, and 5. So now we will discuss in depth. So syndrome of inappropriate antidiuretic hormone SIADH is a oversecretion of ADH due to brain injury, any cancer, lung disease, or certain medications like selective serotonin reuptake inhibitor. So ADH is normally produced in the hypothalamus and it is secreted from the posterior pituitary gland in response to any change in the plasma osmolality and intravascular volume. So basically, ADH helps to regulate the body fluid volume by stimulating the kidney to reabsorb water in the systemic circulation. So what happen in SIDH? So there is inappropriately increased ADH secretions that can lead to excess water reabsorption. So which result in water retention. So that can lead to increased body water. So that can lead to decreased serum osmolality that is less than 285 milliosmolate per kg and dilution hyponatremia. So serum sodium level that is less than 135 and dilution and apart from that water retention that can cause to urine to become very concentrated that result in elevated urine specific gravity more than 1.03 and osmolality. So option 1 and 2, there is increased urine output and increased serum osmolality that is the manifestation of diabetic insipidance. So there is which is caused by decreased hormone of ADH. So now next question. The nurse is teaching a 8-year-old client with type 1 diabetic mellitus. So which of the following task would be appropriate to teach the client to perform. So there is 8-year-old boy. So nurse is provide teaching for diabetic type 1 diabetic mellitus. So options are verbalize three signs, three sign and symptom of hypoglycemia. Yes. Select and clean the finger to for capillary blood glucose testing. Yes. Use a chart to determine the insulin dose based on the glucometer reading. Select an insulin injection site with parent supervision of the rotation schedule. Push the plunger of the insulin syringe after a parent insert and stabilize the needle. So pause the video, think the answer. So we will discuss. So I will select option 2, 3, 4, 5, and 1, all options. So correct answer is only 1, 2, 4, and 5. So option 3 is incorrect. Why incorrect? We will select. So the nurse should offer school age clients age 7 to 11 years. So that is the school age clients as much opportunity as possible to participate in the care to promote psychosocial development so, as theory, industry versus inferiority that provide a sense of control. So, parents should transfer management of care to the client in a small steps based on the client's skill level and cognitive ability. So, it's very important. So, school age clients are in a concentrate operation stage of development and they are mostly successful performing simple concrete tasks with a limited number of steps. So there is appropriate diabetic mellitic self-care task for the school age client include identifying sign and symptom of hypoglycemia plus hyperglycemia, choosing and clean a finger for capillary blood glucose testing before a parent or caregiver perform the puncture. That is correct. Selecting the site for insulin injection for a parent with the parent or caregiver verifying appropriate size rotation. That is important. And pushing the syringe plunger to administer insulin after a parent or caregiver inserts the needle. So these are correct. So in the option 3, so adjusting insulin doses based on glucometer reading is too complicated for a school age children. So that's why option 3 is incorrect. So so that can mistake that can be life threatening. So client develop the cognitive ability to analyze test results and adjust insulin dose at appropriately approximately as the age of 14. So school age children they do not able to calculate the dose and they can lead to mistake. So it can be life threatening. So I think do you are understand now? So remember, practice is the key to passing NCLEX. So keep learning, keep practicing, and the success will be yours. So if this video really helped you to understand endocrine NCLEX questions, don't forget to like, share, and subscribe Manpreet RN Talks for more exam question practice.